Welcome to the Beverly Hills Plastic Surgery Podcast. And as you can tell, the people on our sofa have multiplied since last week.
Yes, we went from the two of us, very cozy, and then last week we had 3, and now we have 4. We're like bunnies.
It's very scary. But Dr. Rovelo, how are you doing today?
I'm doing well. How are you?
I'm
Yes.
good.
Good.
I'm always happy to be here on a Wednesday afternoon, which this is, talking about plastic surgery. And today we have our guests are our plastic surgery, our aesthetic fellows, Dave Stepien and Neil Varanis. Guys, how are you doing?
Doing great. It's an honor to be here. Thank you for the invitation.
Yeah, we're doing great. Great times.
Good. Well, it is an honor to be here, just to have you guys in as our fellows. Number one, since you went through a huge process to get here, which we'll talk about. But we want to just kind of hear about why a fellowship. So we talked last week with Dr. Hillary Jenny, who was in from Johns Hopkins, and she told us about what it takes to get to be a plastic surgeon, period, and then why she was exploring a fellowship. I thought she did a really good job.
She did a great job. We kind of threw her into the fire, and she did great. So she is a...
She did. She kind of like showed
go.
up to like,
Yeah.
hey, I want to spend a week with you guys. Great. You're doing a podcast. Sit down.
But she's a resident, so she did her medical school. Now she's in her residency. She's going to complete that in a year, and then she will be a almost board certified plastic surgeon. And at that point, she can go out and just practice plastic surgery,
For
as
sure.
plenty of us do. But she specifically wants to do a fellowship, and she wants to do an aesthetic surgery fellowship. And that's why she's here. These fine gentlemen surgeons next to me have completed their plastic surgery residencies and are now doing their aesthetic surgery fellowship for a year.
Yeah, and both of you guys came to us through the match, which we did. We also spoke about last week with Dr. Jenny about how you kind of put down your choices and a computer does this matching thing and you wind up getting here. So, Dave, let's start with you. Tell us, again, this is Dr. David Stepien. He is a fully trained and board eligible plastic surgeon, as opposed to Dr. Jenny, who is a resident still training in plastic surgery. He's completed his residency. Where did you do your residency?
So I did my residency at University of Michigan, a little ways across the country from here, a lot colder. But it's a really great training program that I had a great time learning a lot at. It's a pretty intensive training program, very focused on reconstruction, but we did have some really great aesthetic experience at the university itself, and then we also had the opportunity to go over to our private hospital at St. Joe's, where we did a lot of aesthetic surgery, and I learned a lot about it, and that kind of got me started.
So if you got a lot of aesthetic surgery experience there, what was it for you that said, I think I should do a fellowship?
Well, I kind of thought about it like when you would be on a service in residency. Let's say we were on a craniofacial service. By the end of 2 or so months, you were completely locked in to taking care of cleft patients, taking care of little kids, all this stuff. And then you go off service to another thing and then come back and you would have forgotten it all and not be quite locked in. And I really liked that feeling of being locked in on these surgeries and those being the ones that I do all the time. And I figured if I was going to go out and work on healthy people, changing, what is normal anatomy to whatever my patient's goals were, I wanted to have a lot more experience in doing that, specifically in the aesthetic realm. I mean, aesthetics and reconstruction are really closely tied, but I think there's a lot of specifics and nuances in aesthetic surgery that unless you really spend the time doing a lot of it with people who do a lot of it, then you might miss out on those. And then you're going to have a learning curve of your first few years on your patients of how to get better at aesthetic surgery, whereas I can join people who do it a lot and avoid that learning curve and be ready to do really high quality aesthetic surgery for my patients when I'm the attending and they're my patients.
Yeah, I think that's an excellent reason. I think that's probably the reason many people choose to do the fellowship. Just a little bit of a side note explanation. I think a lot of people don't always know that when we say plastic surgery, the majority of what we learn in residency is not the plastic surgery that you see on TV. It's not the aesthetic, breast augmentations and rhinoplasties and tummy tucks. That is a large part of plastic surgery. But in our training, most of what we learn is the reconstruction aspect of plastic surgery, breast reconstruction, fixing bad face smashes and fractures, fixing burns, things that come in, people have had a trauma or cancer or